Safwat Gassis, a cardiologist and a cardiac electrophysiologist. So I specialize in heart rhythm disorders and treatment of irregular heart rhythms. A lot of what I do is prevention of sudden cardiac death and treatment of sudden cardiac arrest. Cardiac arrest happens suddenly, and it's usually as a person would suddenly collapse. So it's not something that's subtle. In order to be able to treat the person, it has to be witnessed. And the bystander is able to call for help, trigger the emergency medical system so that the EMS will come with more advanced treatment. But during those critical minutes, while the EMS is arriving to the location, the bystander has a critical life-saving role where if they perform CPR, they can continue the blood flow to the brain and reduce the chances of neurological injury. And that can have a significant impact on survival. And if that defibrillator arrives within just a few minutes, the bystander can apply that defibrillator in very easy-to-use instructions, apply it to the skin, and it's automatic. It'll tell you what to do, deliver that shock, continue the CPR. You have increased that person's chances of survival by almost tenfold. A person who has a cardiac arrest where a defibrillator is available nearby, the chance of survival is very high. It's over 90% with good functional capacity and a good quality of life. Whereas somebody who has a cardiac arrest at home or at work where a defibrillator is far away, the chance of surviving is 5%. It's between 3 and 10% nationally. So it's a significant difference between over 90% and just 5%. So the bystander has a very, very important role. By doing CPR, you're continuing the partial blood flow to the brain, enough to sustain it, keep it from getting injured. The defibrillator will restore blood flow almost immediately and then allow for the further treatment from the EMS.